In the event of an acute angina attack, finding a fast, easy method to administer nitroglycerin is critical. The following video is designed to demonstrate how to administer GoNitro nitroglycerin sublingual powder, the newest generation short-acting nitroglycerin from the makers of nitrolingual pump spray. GoNitro is the first and only FDA-approved sublingual powder that comes in single-dose packets. Each packet of GoNitro includes 400 micrograms, or 0.4 milligrams, of nitroglycerin, and should be administered in patients for the same use as the other FDA-approved short-acting nitrates available in sublingual 0.4 milligram tablet and spray formulations. GoNitro should not be used in patients with acute circulatory failure or shock, and not in patients with increased intracranial pressure. For more information, see the important safety information at the end of this video, or refer to the full prescribing information in each product box, or at www.gonitrorx.com. Read the instructions for use before administering GoNitro, and each time you administer the product, there may be new information. For the purposes of this demonstration video, placebo packets will be used in the place of the active product, GoNitro. The GoNitro packet is white, red, and black, so make sure to use the actual product, GoNitro, for the acute relief of an attack or prophylaxis of angina. GoNitro delivers fast relief from acute angina attacks and may reduce waste or risk of cross-contamination with its single-dose packaging. GoNitro should not be used in patients who are taking medications for erectile dysfunction. Using GoNitro with these products may cause hypotension, fainting, or heart attack. The single-dose packet is easy to administer to your patients who are experiencing an acute angina attack. Tap, tear, and tip is a simple way to remember how to administer GoNitro. But in this short video, we will demonstrate the 6 FDA-approved steps outlined in the instructions for use when administering GoNitro. First, hold the packet of GoNitro upright with the notch and red arrow line at the top of the packet. Second, tap the packet to ensure all the powder settles at the bottom of the packet. Step 3 is to simply hold the GoNitro packet at the notch as close to the patient's mouth as possible and tear along the red arrow line. Step 4 and 5 is to have the patient lift their tongue and tip and pour all of the powder in the GoNitro packet under the patient's tongue. For step 6, close the patient's mouth right away and have them breathe normally through their nose. Allow all of the powder to dissolve before having the patient swallow. Do not rinse the patient's mouth or have them spit for 5 minutes after taking GoNitro. If the patient's chest pain continues after the first dose and transport to the hospital is indicated, you can administer additional doses of GoNitro in the ambulance as directed in the prescribing information for GoNitro. First, hold the packet of GoNitro upright with the notch and red arrow line at the top of the packet. Second, tap the packet to ensure all the powder settles at the bottom of the packet. Step 3 is to simply hold the GoNitro packet at the notch as close to the patient's mouth as possible and tear along the red arrow line. Step 4 and 5 is to have the patient lift their tongue and tip and pour all of the powder in the GoNitro packet under the patient's tongue. For step 6, close the patient's mouth right away and have them breathe normally through their nose. Allow all of the powder to dissolve before having the patient swallow. Do not rinse the patient's mouth or have them spit for 5 minutes after taking GoNitro. Like other sublingual short-acting nitrates, GoNitro also can be administered to patients wearing a CPAP mask. Follow the same 6 instructions demonstrated earlier and remove the CPAP mask prior to pouring GoNitro under the patient's tongue. GoNitro's unit dose packaging preserves stability and potency, so it's ready to go when you and your patients need it. Each box of GoNitro comes with full prescribing information and instructions for use. You can also call 800-235-6520 if you have any additional questions about the product or if you would like to know how to order GoNitro. GoNitro nitroglycerin sublingual powder should not be used if you are taking medications for erectile dysfunction, such as Avanafil, Sildenafil, Tadalafil, or Vardenafil. Using GoNitro with these products may cause low blood pressure, hypotension, fainting, or heart attack. Do not use GoNitro if you are taking soluble guanylate cyclase stimulators, such as Riociguat, as this may cause low blood pressure. Do not use GoNitro if you have anemia or if you are allergic to nitroglycerin, other nitrates or nitrites, or any excipient. GoNitro should not be used in patients with increased intracranial pressure. Talk to your doctor if you had a cerebral hemorrhage or traumatic brain injury before taking GoNitro. GoNitro should not be used if you have acute circulatory failure or shock. You might develop a tolerance to this drug or to other nitrates and nitrites. Only the smallest number of doses required for effective relief of the acute angina attack or prevention of an attack should be used. Nitroglycerin may aggravate the angina and should be used with caution if you are dehydrated due to drug therapy or if you have low blood pressure. Increased hypotension may occur even with small doses of nitroglycerin and may result in slow heartbeat and increased angina. Headache is the most reported side effect. Other side effects that have been reported are dizziness, numbness and tingling of the skin, skin scaling and rashes, drowsiness, nausea, increased heart rate. For full prescribing information, please visit GoNitroRx.com. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/MedWatch or call 1-800-FDA-1088.